I'm Bob Atfield. I'm the Regional Director for We Care Home Health Services. I have responsibility for our We Care branches throughout Alberta and British Columbia. Across Canada, We Care has 50 offices. We're a national organization, and we provide home support and home care services in over 800 communities across the country. There we are. And it's a pleasure to be here today. Really, thank you for the invitation, Gloria. Thank you very much. A lot of what I'm going to speak about, you've heard about today, but I'm going to take it one step further and talk to what the implications are on the clients. I'll note as well that my parents are the clients. My parents, my mom's 84, my dad's 86, so I'm going to draw some parallels with some of the challenges that we face in terms of staffing with situations that my parents face on a daily basis. Yeah, so basically through all of this is human resource challenges and putting the client need first. I think that's the most important thing. That's why we're all here. That's why we're all service providers and health authorities, is keeping in mind that the single most important component of this process is the quality of service delivery and the impact that it does have on our loved ones. That's so important. Just a little bit of perspective, and I know this will corroborate some of your statistics as well, that by 2016, 50% of the population will be over 60 years of age and will have a life expectancy of 82 years. 1 in 3 will develop a life-threatening cancer. 25% currently of individuals have a family member that's suffering from Alzheimer's or dementia. So there's a message there in terms of the education and training that we should be continuing to provide to our care aides. And 93%, that's a national figure, 93% of seniors still live in their own home. So BC at 94% is slightly higher. So the bottom line here is, we need to focus on developing more qualified and certified care aides and a more stable workforce. I think that's the underlying message that Ed's been talking about and that Winona was talking about as well. And if I could make one more comment, and Winona touched on it as well, and that's that care aides are treated as though they are the lowest rung on the healthcare ladder, which is very unfortunate because they're probably the one individual that a senior sees more than anybody else in the healthcare system. And perhaps it's the one individual that they see even more so than their own family. So these are individuals that we need to really focus on and treat with respect, and I think that'll go a long way in terms of improving retention rates within the community. They're the unsung heroes. On any given day in the Lower Mainland, when I run working some numbers, there's between 2,500 and 3,000 care aides, the Lower Mainland and the Fraser Valley, running around in the streets providing service to our seniors. So it's an army of individuals that are highly dedicated and very proficient for the most part at what they do. So they really do deserve a pat on the back for what they do every day. Just a little bit of a reality check. In addition to the care aides that we have in the community, family caregivers, an estimate is that the value of the services that they provide to their families is about $26 billion a year. The Canadian Institute for Health Information reports that the provinces and territories spend less than 4% on providing home support services to our seniors. So I've broken it down to 3 components, and I'll speak briefly to each one of them because I think you've heard more detailed discussion about these points from the previous speakers, and then I'll talk about the implications that and the challenges that these result in terms of the quality of care to our seniors. Casual workers versus full-time positions. Some care aides choose to work on a casual basis. It suits their lifestyle. It gives them some work-life balance. But most that go to school to become a registered care aide, a certified care aide, are expecting to get a full-time job once they graduate. Unfortunately, the reality is that's not the case. It's more difficult to get a job out of school in a facility. So what happens is they take a job in the community on a casual basis, perhaps piecing together a full-time job with 2 or 3 different organizations. And then as soon as a position comes open in a facility, boom, they're gone. And not only because they can just drive to work and drive home again, they don't have to fight traffic in the community, but they're also paid I believe between $1 and $2 more per hour for working in community or working in the facility. So as a result, we have very high turnover within the community health worker realm. The second one is training and education. I'll touch on that more in a minute. And also workforce demographics, which we'll speak to a few of Mohinder's points that he made when he was speaking at the microphone a few minutes ago. I touched on most of these points already. Certainly when someone goes to school, they go to school with the expectation they're going to be able to feed their family and have a constant source of income. That's often and most often not the case when it comes to care aides working in the community. Many care aides, I sort of always struggle with them working 50 and 60 hours a week because the risk is if they're working for 3 different employers, as one employer we have no control over the number of hours that they're working. So they run into situations where they're putting themselves at risk, where they're burning out and there's constant fatigue. So that's something we'll talk about in a minute as well. And I also did mention already about casual care aides leaving to go and work for facilities. Now the impact on the client, well, obviously I can speak from my parents' perspective. Continuity of care is probably the single most important aspect of care for my parents and for our loved ones. My parents live in Ontario, and they get service through the public health care system there. And they were pretty excited at the start that they were going to, get some service. My mother has dementia. She sunsets at about 4:30, 5 o'clock in the afternoon. My father still has a healthy appetite, and he likes to eat. So we arranged for service through the health authority, and it was constantly a different person coming to the door. There was very little in the way of continuity, to the point where my mother got frustrated because she was constantly having to retrain the care aide that was coming to the door. Not the care aide's fault. They knew how to do it. They just needed to know what had to be done. And unfortunately, for the first 2 months, I lost count of how many different care aides came to the door. And my mother finally threw her hands up in exasperation and said she herself canceled service because it was taking too much of her energy to constantly be retraining the care aide. So continuity is extremely important. And to the gentleman's point who spoke at the microphone, that's what I've experienced as well. And that does need to change. So retention and reducing staff turnover, I think, is imperative in terms of improving the quality of care that we provide to our seniors. It also, when it comes down, if you look at it from a dollars and cents perspective, it's we're not delivering, or the instances are that we're not delivering the service, and so it really is a waste of our healthcare dollars. So if we can get to the root cause and improve overall retention, it's going to make a huge difference, I think, in terms of the budget that's available to provide service to our parents. The next one is training and education. Program curriculums really do need to stay current with what's happening in community. We all see it every day. The acuity of care is changing and increasing every day, so it's very important that the service providers be plugged into what the curriculum is at the various colleges and universities that are training our care aides of the future. And so there has to be ongoing collaboration, and that's something that Winona pointed out in her presentation as well. And when we hire care aides, we find that there's so many deficiencies in the services, in their abilities, that we're spending a lot of time retraining them and bringing them up to speed on issues like specific Alzheimer's and dementia training, palliative care, actual services that through our own surveys we've determined are meeting the needs of the individuals in our community. And to me, that's what's so important, is that education is continues after an employee has been hired by an organization. We do a staff survey, and we also do a survey of our client needs. And out of that drives our in-service plan for the coming year. And every community is different. Every community has a different in-service plan. The common elements in all of our in-service plans across the country are palliative care, Alzheimer's, dementia care, and diabetes care. All of the care aides every year have to be recertified with CPR. So in-house training is imperative if we're going to meet the demands that we have in our community. So again, if we don't have proper training, we have risks. We have safety risks to the clients. Proper training on lifts and transfers. If the staff aren't trained properly on lifts and transfers, then obviously we're leaving ourselves vulnerable to hurting not only the client, the patient, but also the care aide hurting themselves. So that's certainly imperative that we have that basic training. Hand hygiene, something as simple as hand hygiene that protects both the client as well as the individual. And then again, when we have a care aide that's off because they've injured themselves, there's risks to the costs to the employer associated with higher WorkSafe premiums, as well as higher costs to the healthcare system in general. When there's when a senior's injured, it's pretty serious. The third one is demographics. We have an aging workforce that we're dealing with. Historically, the profile of a care aide was a single mom in her early 40s looking to get back into the workforce, and because there's low barriers to entry, let's get in and be a care aide. They're great care aides, very dedicated, but like everybody else, we're getting older. So the average age of a care aide in British Columbia is pushing 50 years old. And we have a lot of care aides who are seniors themselves, and so we have to be very careful that we're not putting them into a vulnerable position and getting into heavy work. It is very difficult work, and hence mitigating the risk of them hurting themselves. It is difficult to attract younger individuals into the profession. It's something that I know that the study is targeting. When I go to high school graduations and I'm giving out a scholarship on behalf of Rotary, so many of the young girls going across the stage want to be an RN. They want to be an RN. I don't know how many actually end up being RNs, but I think if we were to start educating through the counseling services at the schools, that start as a care aide. And see if you like it enough, whether it's facility or in the community, then you can ladder to be an LPN, and if you want, even ladder to be an RN. I think we really need to focus on building the profile of this as a profession, as well as really nurturing our young individuals, our young leaders of the future to get into this profession. So I think we're certainly on the right track as far as the program's concerned. And the final one's communication. Mohinder raised a very valid point. We have clients of every nationality, and it is a challenge for us to, when we get a phone call at 4:30 on a Friday afternoon, to find a care aide that speaks Vietnamese and or Spanish or whatever language. So those communication skills are extremely important, and if we aren't able to accommodate those, then again we're putting our seniors at risk, because if they can't communicate, then we're opening up the door for too many problems. So again, bit of a recurring theme. The risks are injury to the client, injury to the staff, and higher costs overall to the healthcare system. And in conclusion, we need to find more creative ways, which is being worked on, to provide full-time positions for care aides. We need to encourage more collaboration between service providers and the colleges and universities that are training our care aides. And we need to target a younger population base to encourage them to enter the profession. And those are my comments. Good.